my name is Caitlin. I'm a nurse practitioner here at your Wellness Center Med Spa. We are getting ready to do a live Dysport demonstration. I'm going to walk you through the steps that I do before I inject, and that is the facial expression and facial anatomy assessment, and then we're going to do the live injection. Prior to injecting Botox or Dysport, it's really important to assess the facial anatomy and how the individual patient's face moves. For this patient, her main concern were the lines that were forming right here. They're the vertical lines, we call those the 11s, and also the horizontal lines across the forehead. So when you're starting to inject, it's important to have the patient make facial expressions. So the first expression is to frown. And you can see when she is frowning, there are three main muscles right through here that contribute to the frown. These muscles are called corrugators, and they are depressor muscles. So when you frown, that's why everything squeezes inward and it goes down, forming those vertical lines. There's another muscle, relax. This is called the procerus. Some individuals will get horizontal lines right through here on the bridge of their nose, and that is from this muscle. When you frown, it actually pushes down. On her face, she does not have those horizontal lines, but if you do have those horizontal lines, it is because of this muscle right here. When we inject Botox or Dysport into these muscles, it is going to soften that depression and actually lift and open up the eyes. So it's going to help lift the eyebrows and give a nice little eyebrow lift, making the face look more refreshed. For the forehead, there's one large muscle, and this is called the frontalis. This muscle is actually an elevator muscle, so it lifts, whereas these muscles go down. So when you're injecting Botox or Dysport into the forehead, go ahead and lift. It's really important to stay high up on the forehead and not too close to the eyebrows. When we inject Botox or Dysport up here, it's going to smooth and soften these wrinkles, but it actually is going to drop the forehead a little bit, which is going to drop the eyebrows. So if any of you have ever been injected before and you felt like you had droopy eyebrows afterwards, that's why. There was too much Botox or Dysport up in the forehead and not enough Botox or Dysport around the eyes to help compensate for that lift. Another point to make, some patients will get a drooped eyebrow, or you may have heard of a horror story of somebody having a drooping eyebrow. What happened is, you can inject into this muscle. There's an eye muscle that kind of comes around like a backwards C shape almost. If the injector injects this too high, it's going to go right in the forehead muscle, and again, it's going to drop the eyebrow. I was saying with the forehead, you really have to stay high up. The other thing that can happen is if I were to inject her right here and she goes home and she has an eye itch and she's rubbing her eye and pushing that Botox or Dysport up into the forehead, it's going to drop her eyebrow. This is something that can be fixed, and a lot of injectors actually do not know this. You can fix a drooping eyelid. Another thing that can happen that is a bad event, when you are injecting around the eyes, targeting those lines, some of this Botox or Dysport can go into the muscles that control and lift the corner of the mouth when you smile. So if I was chasing these lines and I went too low, I could inject into these muscles, which are elevator muscles. Smile. It controls your smile. Go ahead and relax. And so if the Botox or Dysport goes into this muscle, it's going to drop the corner of the mouth. Same thing, if she were to go home and start rubbing her eye, she could push this product down into this muscle. This, unfortunately, the dropping the corner of the mouth, cannot be fixed. The eyelid drooping can be fixed. The corner of the mouth drooping cannot. It's something that will wear off over a period of 2 to 3 months. But the reason I go over all of this with my patients is I want them to understand why these events happen, how we prevent them from happening, and what they can do at home to prevent these from happening as well. Now that we have assessed her facial anatomy and the way that her facial expressions work, we are going to go into our live injection now. Today we are using a product called Dysport. This is still botulinum toxin A. It's very similar to Botox, which a lot of us are more familiar with. Botox and Dysport are essentially the same thing. It's kind of like Coke and Pepsi or AT&T and Verizon. The biggest difference is Dysport kicks in a little bit faster, so she'll see her results about a week sooner than she would with Botox.